Hi there, my name's Bella, and today I'm going to be talking about the Adson's test. And the Adson's test is a test that tests for thoracic outlet syndrome. And thoracic outlet syndrome occurs when nerves or blood vessels between the collarbone and the first rib are compressed. And so when they are compressed, it causes pain in your neck and your shoulder, and it can also lead to numbness or tingling in your fingers. Some common causes of this are physical trauma, repetitive injuries, anatomical defects, and even pregnancy, because in pregnancy everything's very swollen. Some different types of it are the neurogenic and vascular types of thoracic outlet syndrome. This specific test, the Adson's test, tests for the vascular side of it. So it's testing to see if the subclavian artery is being compressed by the pec minor and the scalene muscles. This test has a specificity of 53% and a sensitivity of 72%. Yeah.
So now we're going to do the Adson's test. And so first I'm going to have the patient sit, and then I'm going to have her bend her arm and put it at, or extend her elbow. And then I'm going to externally rotate it at a 30-degree angle. Then I'm going to palpate her radial pulse. And then while I'm holding her arm, I'm going to have her extend her neck. So if you could extend your neck back for me. And then if you could turn towards your injured location, which would be your neck or your shoulder that's giving you pain. And then if you could breathe in and then hold it. And so then while she's holding it, I would be palpating her radial pulse. And if her radial pulse weakens or completely diminishes, that is a positive indicator that she has thoracic cavity syndrome.
I just want to clarify the last thing I said in the last part of this video. It's actually thoracic outlet syndrome, not what I said a second ago, just to clarify. And also to clarify further, I want to further explain what thoracic outlet syndrome is and why the Adson's test works. So thoracic outlet syndrome, as you can see here in this visual, it's when we have the artery and nerves, in this case being the subclavian artery and the brachial plexus. It's being kind of crushed by the different muscles that surround it, so the pec minor and the scalene muscles, as well as the bones of the first rib and the clavicle. And since it's already being pressed on, this test allows for us to see by raising the arm and palpating the radial pulse to see if it's completely occluded when you put it in more of a pinching position, which can help indicate if your patient has thoracic outlet syndrome. And so that's all I have for you guys today, and thank you so much for listening.